laid out 6 specific indicators that would guide our decision-making based upon health, science, real data, not politics, not pressure. Those indicators created a framework for decision-making that we committed to update you on a weekly basis. Today, we will update you on those 6 key indicators that are informing our decision-making as it relates to augmenting and modifying our stay-at-home order. And we'll dive deep into one of those indicators, specifically on the area of testing, tracking, tracing, isolation, and quarantine. Dr. Galley will make that presentation here just in a moment. But first, I wanted to set things up and create a context for this discussion. I deeply recognize, deeply understand the desire for people to hear directly from the administration, from the state and its leadership about the answer to when. When can we go back to some semblance of normalcy? While a vast majority of you, I think, recognize that decision needs to be guided on the basis of the virus and its spread, decisions on the basis, always first and foremost, of public health, the pressure to answer that question, nonetheless, is very real. No one wants to be able to share that information more with you than I do. And I wish I could prescribe a specific date to say, well, we can turn out the light switch and go back to normalcy. We have tried to make it crystal clear that there is no light switch, and there is no date in terms of our capacity to provide the kind of clarity that I know so many of you demand and deserve. The clarity, however, we are providing today is the clarity of indicators that guide that decision-making and the transparency around those indicators and that framework that allow us to organize around 6 specific themes and teams to every single day monitor conditions on the ground. It's driven not by ideology, but by argument, by evidence, and by the curation of best practices, not just across the state, across the country, but from around the rest of the world. We led with that first indicator that we'll talk about more in a moment around testing, tracking, tracing, isolation, and quarantine. But we included in 5 additional indicators considerations that we must around making sure we protect the most vulnerable Californians, our seniors in skilled nursing facilities, nursing homes, assisted living centers, those that are vulnerable out on the streets and sidewalk, the homeless, people with compromised immune systems. Send that laid out framework for our second indicator, how we protect the most vulnerable. The third indicator was around hospital capacity, healthcare delivery capacity, not only within the hospital system, but the creation and the opportunity to provide alternative care sites and facilities, to do so not just with physical assets, but to make sure we have the human resources, the people, and the protective gear to make sure that the health workers are healthy and safe at the same time. We had a fourth indicator around the issues of therapeutics. We talk a lot about herd immunity, vaccines. We in California are uniquely positioned because of the National Institute of Health. 4 of the top 10 funded NIH sites are in the state of California. We are blessed and endowed with some of the finest research institutions and hospitals doing therapeutic studies and advanced therapeutic partnerships in this state. It's respectfully among the most robust of any state in this nation. So therapeutics also is a category that guides our decision-making. The issue, obviously, of businesses, issues related to schools and physical facilities is another area that guides our consideration. That's indicator 5. I've made it clear in the past that we won't just open things. We'll have to open things and modify how we conduct our business, how we educate our kids, how we take care of our children. And we talked about floor plans just a week ago and what that looks like in terms of practicing physical distancing as we begin to process the considerations for reopening the economic sectors in our society. And finally, the issue of what happens if we overcompensate. overtaxed? What happens if we get ahead of ourselves and we start to see a surge of new cases, hospitalizations, people in ICUs? What's our capacity to reinstate some of these conditions and hotspots, and our capacity to project some confidence in doing so and confidence in you that doing so is appropriate and you'll abide by those rules at the same time? Because we are not lost on us. Trust is the most important commodity in these conversations. Building that trust with you, 40 million Californians, to make sure we're continuing to practice physical distancing, social distancing, and abiding by these guidelines, recommendations, and directives. But we recognize we're testing that trust every day because of the deep desire for people to begin to know when they can get back to work, when they can go back out and recreate and enjoy the beautiful parks and beaches in the state of California. And so today we want to further that conversation. I want you to know you'll be left wanting if you woke up to this discussion and we're going to hear that we're reopening large sectors of our society. We're not prepared to do that today. I very much look forward to making those announcements, and we won't wait week to week to make those announcements. When we're ready, we'll make those announcements in real time. But I am ready today to make the following announcement. We have been working with our partners in Washington State and Oregon, guided by their experts and guided by their examples, and helping us to inform our own efforts here in the state of California. And based upon Indicator 3 and the work that we have done together in providing alternative care sites, the incredible work that the hospitals have done to decompress their existing facilities and provide capacity to increase surge, and the incredible workforce that's been assembled, we are in a position today to begin to pull back and lean in by beginning to schedule surgeries once again throughout not only our hospital system, but our broader healthcare delivery system. These are surgeries that, yes, are scheduled, but also are essential. Tumors, heart valves, the need for people to get the kind of care that they deserve. If it's delayed, it becomes ultimately denied. It gets delayed, it becomes acute. And that's fundamentally is a health issue. And so beyond just the issue of the virus, we are working with our health directors and throughout the healthcare delivery system to reintroduce the capacity to get these scheduled surgeries up and running again. We will be very thoughtful and judicious about how we do that. We will not overload the system at peril of not being able to maintain our surge capacity. And we recognize anytime we begin to toggle back and start opening things back up, we have to look every day at the data, the dashboard of information coming back, to make sure that we are adjusting to these new decisions and maintaining an understanding that we need to be vigilant about the intended consequences of these decisions and the unintended consequences of these decisions. So if you are asking yourself, well, how can we guarantee if we're bringing back all of these scheduled surgeries that there'll be availability if we see a second wave or a large surge as we start pulling back, that we have capacity? We are monitoring that, and that's foundational in terms, again, of this dimmer, not light switch, that we are advancing in terms of just beginning to shift things, but recognize that that shift, that dial, could be turned up or the dial can be turned back in real time. But this is, for us, a significant health-first focused announcement today to begin to augment the stay-at-home order, but to do it with an eye on public health and making sure we secure the safety of our healthcare delivery system.